The following is a CKCO-TV special presentation.
You'd rather look the way you did 10 years ago.
That's right. I'd like 10 years off my face. Mm-hmm.
The only incision is going to be right here. What bothers you when you look in the mirror? What would you like to see changed? Get the cheeks up in here, as it sit right in here to get that improved there. Mm-hmm. And in the neck as well, to get the neck a little better angle here. You'd say, gee, she looks good, but you wouldn't say to yourself, she must have had a facelift.
Looks nice and relaxed and natural.
Exactly. Natural is a secret. That's the secret word, is natural.
Tonight in this Better Life special, you'll get an intimate look at one woman's experience with facelift surgery. She shares her expectations beforehand and her reaction to the results. In the meantime, you'll get a close-up view right over the surgeon's shoulder in the operating room. Stay with us for the next half hour and find out what a facelift is really all about. A facelift is an intensely personal and private experience. Someone disappears for a while, and when you see that person again, they have a much more youthful, refreshed look. But the surgery is not something they're prepared to go public with. Well, tonight, one woman does just that, letting us in on her facelift experience from the decision-making through surgery, recovery, and the final results. It's a unique opportunity to get the inside story. First, the consultation. Meet Beryl Smart. She's 50 plus and ready for rejuvenation of the cosmetic surgery kind. Like everyone who finds themselves in a plastic surgeon's office discussing a facelift, Beryl has her own particular reasons.
This year I've had a lot of migraines, and so with pain they've added a lot more wrinkles and lines, and that's what I'm concerned about.
The doctor's concerned with exploring a potential client's motivation for surgery.
What bothers you when you look in the mirror? What would you like to see changed?
There's a lot of skin there, and they even hide my eyelashes, the lines here, and my neck.
Beryl wants the works, a standard facelift combined with a brow lift and eyelid surgery. Dr. Peter Wyshynski is going to demonstrate what he can surgically do for her. And in the last 10 years, the possibilities have improved a lot.
Modern facelift consists of going deeper and tightening the layers around the muscles, tightening the muscles themselves, and the ligaments and fascial tissues around the muscles that actually support and sling up the cheeks and the neck.
Like Beryl, a patient typically has deep cheek folds, jowls, and loose skin in the front and side of the neck. To perform the facelift, incisions are made on each side of the face, from inside the hairline at the temples, around the earlobe to the lower scalp. There's also a tiny incision under the chin. The incisions provide access to loose skin that has separated from the underlying muscle in the shaded area. The loose skin is pulled up and back, remolded to the contours of the face and neck. The excess is trimmed away. Most scars are hidden in the hairline and behind the ear, or in natural skin lines and creases.
Now another area that you mentioned, Beryl, is this in here, this heavy look.
Mm-hmm.
In Beryl's case, more incisions will be required to do the brow lift and the eyelid surgery as well. The degree of success of the surgery depends on a person's health and habits too, like smoking, drinking, and diet. Reasonable skin elasticity and good bone structure count too, and you must have realistic expectations.
So I want to make sure that the patient knows and realizes what can be done and also what can't be done, which is very important.
Dr. Wyshynski turns down 50% of the people who come to see him about getting a facelift, but he's decided Beryl is a good candidate. At her age, in her mid-50s, she is typical of the trend the surgeon sees in women and men coming to him at a younger age for their first facelift, a trend he says is producing better results.
The younger you are, the better your circulation, the stronger the skin is, the better the healing is going to be, and the nicer the scars are going to fade.
Also in Beryl's favor, she's realistic, looking for improvement, not perfection in a facelift. To her, it's a matter of maintaining a standard of personal appearance, not a self-esteem issue.
My self-esteem is pretty well up there.
So it's just
I'm
kind of, you'd
fine.
rather look the way you did 10 years ago.
That's right. I'd like 10 years off my face. Mm-hmm.
To turn back the clock a decade, it's going to cost almost $1,000 per year here at Dr. Wyshynski's Cosmetic Surgery Clinic. So it's mutual. Beryl wants a facelift. Dr. Wyshynski's prepared to do it. Before her surgery date, he wants to make sure Beryl is familiar with the operating environment. She says she has no concerns about going under the knife.
Absolutely none. No.
Doesn't
I can
worry you
honestly
in the
say
least.
no, it doesn't worry me in the least. I'm in good hands.
It's a good thing she feels that way because what Beryl's facing is hours of extensive, delicate surgery under a general anesthetic. When we come back, the operation. Usually what you see when it comes to a facelift is limited to the dramatic impact of before and after. Tonight, you're going to see much more than that, so be prepared. We're going right into the operating room. We'll be at the surgeon's side throughout most of the 6-hour procedure. Beryl Smart goes under the knife, as they say, and you're going to get a close-up view of some very graphic shots. Operation day has arrived, and despite the hours of surgery ahead of her, Beryl is calm and relaxed. There's a routine checkup while she's prepped for the operating room. Now she's ready for surgery, so it's on to the OR. The anaesthetist is standing by. It's going to be a long operation, and the amount of drugs Beryl gets throughout the facelift will be monitored closely. So will her vital signs.
Warm enough? Mm-hmm.
Has she had any second thoughts this morning?
My one thought was, gee, I slept all night. I'm really not nervous about this.
Soon, Beryl's off to La La Land, and Dr. Peter Wyshynski is ready to begin a 6-hour stint in the operating room at his Waterloo clinic. With several before photos of the patient on hand, the facelift gets underway with a marking session. First, the doctor maps out landmarks as guidelines to help maintain accuracy once the head is draped for surgery. The smaller broken lines indicate where incisions will be made.
Obviously, you're always able to kind of hide those in the natural folds of the ear and so on.
The only part that's going to show is right here, and that fades very, very well on most people. And then initially in the first few months, I suggest that the first few months that they bring their hair down a little bit like that, and that hides that. And after a few months, even that is, in fact, sometimes in a few weeks, that is very, very hard to see. And I do many men who don't have the luxury of long hair to cover any incisions, who have marks that are virtually almost invisible.
Now the plan is ready to go into action.
So it'll be this gone here, this gone here, this up in here, the lines improved here, the jawline and the cheeks made smoother here, and the neck snugged up like that.
One of the surgeon's goals is to make sure scars will be hidden in the natural folds, so they are as inconspicuous as possible. And of course, the main objective is an overall natural look.
So what would you say are the two main factors then in a good candidate?
Bone structure and good skin.
By that you mean a lot of elasticity.
A lot of elasticity, not very lax, weather-beaten, inelastic skin.
And not an excess of wrinkles through aging or sun damage and that sort of thing.
Yes. Sun-damaged, overly wrinkled skin doesn't do as well, because in order to try to take out those wrinkles or improve them, one might have to do a lot more pulling, which is not a good idea, because that could produce a very tight look. And to me, a secret of a good facelift is one that does not look over-tightened, does not look operated on. One that if you saw at a party or on the street, you'd say, gee, she looks good, but you wouldn't say to yourself, she must have had a facelift.
Looks nice and relaxed and natural.
Exactly. Natural is a secret.
Local anesthetic injected now will help control the bleeding during surgery, and that means there's less bruising later.
What this does is it has a double effect. One is to deaden the skin around the incision so that there's less feeling. So it means there's less anesthetic necessary on Judy's part to keep her asleep, which is safer and nicer for her after. And secondly, this medicine cuts down on the bruising and swelling and bleeding. So there's less bleeding at the time and less bruising after.
That helps her heal faster.
Yes.
Dr. Wyshynski scrubs up, and he's ready to begin the facelift.
What I'm doing is I'm stitching sterilized towels. So we sort of surround the whole perimeter of the surgical site with sterilized towels and sheets.
The first step is a small incision under the chin.
First I'm loosening the area under the skin just to make it easier to get at the fat. So I'm just loosening everything in here. So my guideline, that's why I drew the jawline, so I know where I'm going to go.
And the liposuction instrument is inserted to vacuum out the excess fat.
What did you do before you had liposuction?
Oh, it was done in a similar way, but in those days you made a bigger incision and actually just took out the fat with scissors.
Next, the surgeon turns his attention to this incision in front of the ear. He's lifting the skin from underlying tissue, so he'll be able to pull it back, tightening the cheek.
What my plan is, as you can see, I've already started loosening up, and I'm going to be doing even more, is this shows how much extra skin we're getting. And so this is where her ear is. You see her earlobe is now down here. So that's already the excess we've developed. And I think we will get about 1.5 times that.
There's a lot of delicate surgery that needs to be done now, so we're going to return in a few hours.
The facelift operation is a rather lengthy procedure. The surgery is about 6 hours. We've been out of the operating room for about 2.5. We return now to join the surgeon and the rest of the team and see how the facelift is progressing.
While we've been away, a lot of tightening up has been going on in the cheek and neck areas.
I've also tightened the inner layer of the skin, because a facelift, a modern facelift, isn't simply just skin tightening, it's also tightening of the muscles inside in the cheek line.
And that's what makes the effects of the surgery last for many more years than it used to. The excess skin has been trimmed, and suturing to close the incisions around the ears is also being finished up now.
Most of the stitches I use are the type that are buried, so they're hard to see, so they leave very few stitch marks. So that's already stitched in here and in here. I've also tightened the forehead. As you can see, I've gone under the scalp and I've gone right down in here and tightened all the things in the forehead here, the muscles and the scalp, to take out all the wrinkles. So there are no more forehead lines or wrinkles now. That's all been snugged up. And that's all been closed with special little staples. In the scalp, traditionally one used to use stitches. The stitches are a little harder on the hair roots, and it takes longer for the hair to come back. So I now use a little clips.
The final procedure involves removing extra skin from the eyelids. And by the time Dr. Wyshynski's ready to cut, there's surprisingly little blood thanks to the local anesthetic. By taking the skin from the crease in the lid, the marks made by these sutures will blend right in.
This stitch line is going to fade very, very nicely in the natural line of the eye. So when the eye is open, it'll be very, very difficult, if not impossible, to see this. Now I'm going to go ahead to the lower eyelid. And the lower eyelid, I'm just going in just under the eyelashes, right in here. First I start right in here. Well, what I've done, Janine, is I've gone in here 1 millimeter under the eyelashes. So there's the eyelash line. I've gone under this 1 millimeter under the eyelashes, loosened all of the skin here, under here, and here's the extra that we're getting rid of in a minute. You see, that's the excess. People often say, can't you get rid of all those bags? Well, there's the extra bags. So we've gone from here to there.
The facelift is nearly complete, and Beryl will be going home in just a few hours. When we return, the bandages come off. Beryl begins weeks of recovery, and then we'll see her new look. Now you know, a facelift is serious surgery, and an operation that involves 6 hours of surgery takes some time to recuperate from. A full 6 months, in fact. Before we get to the results, we're going to see how Beryl Smart fares throughout her recovery, starting from day one after the facelift. It gets gruesome before it gets glamorous, so I'll just warn you, some of the early pictures are pretty painful to look at.
Just gonna sit right here, make yourself comfortable, okay?
It's less than 24 hours since the facelift, and Beryl returns to the cosmetic surgery clinic for her first checkup. The gauze and bandages are slowly removed.
Did you stay on the couch then, or did you go to bed?
I just sat up in bed with
Did you?
pillows
Lots of pillows
behind
and
me.
yeah.
Mhm.
Well, whatever's the most comfortable. Sometimes those lazy boy chairs, they really come in handy because they
Oh,
sort of just
yeah.
prop you up in the right way. Just
mother.
lift your head up, just a bit. I just want to pull all that out. There you go. Okay.
It looks painful and feels that way.
Do a lot of people have this much pain? Bruising?
Bruising and swelling, yes.
Well, Beryl, not quite 24 hours yet.
Dr. Peter Wyshynski examines his patients every day for the first few to make sure the healing process is well underway. Some incisions are reinforced with surgical tape. And once the post-op bandages come off, a simple sling is used to wrap the head for the next day or so.
Even though you may feel as if you were hit by a bus, it looks good.
Okay.
And it's very, very temporary. It's going to go away.
All right.
And there with your kerchief on and with the scarf on like so, you're going to walk out and everybody's going to wonder who this incognito movie star is in town.
It's day 2 after surgery now, and Beryl is back. The stitches are being removed from her eyes this soon to avoid scarring.
Now those stitches came out and that wasn't too uncomfortable, was it?
Oh no.
It's surprisingly easy.
With the stitches removed, a little tape is applied to the incisions around the eyes.
Swelling is always at its worst by the second 2 days after. So today is going to be your most bruised and swollen day. And from now on, you're going to get better and better all the time.
Dr. Wyshynski checks for excessive swelling and makes sure all surgical wounds are clean. Things look good, and Beryl's feeling well enough to joke a bit about the fringe benefits of surgery.
I've been sipping on soup, but really after anesthetic, you don't have an appetite anyway, so it's a good way of losing a little bit of weight.
Her only complaints, some headaches and some trouble sleeping.
48 hours and you look and feel good.
Right, great.
Come, swing your feet to one side here. I'll get you to your kerchief.
All right, thank you.
And the 3/4, if you look here, you can see the change in there.
Very much so.
1 week later, we're ready to inspect the before photos and compare them with the results this far.
And then just the full face again, as Janine can see there, it's totally different. This is all gone better.
That's the most dramatic one, I think, that full face.
But each snapshot shows the significant changes noticeable after just 1 week.
Try to show frown. You can't. You can't, because those frown lines are now gone.
Recovery times vary, but as far as a surgeon is concerned, the full and final results take 6 to 12 months.
That's why I don't take after pictures until 6 months.
Why does it take that long?
Because the body takes its own time to finish healing for all the swelling to settle down. But that's the theoretical maximum. People actually go back to work usually in 2 weeks with a little makeup. They may be a little bruised here, a little puffy there, but they can go back to work looking quite acceptable. And in 5 or 6 weeks they can go to a party looking super and no one will be the wiser that they ever had any surgery. And in the 3/4 view, you bring it around a little bit to there. This is all better in here and in here.
Every case is different, but patients can expect the final results to last at least 5 years, even up to 10. For Dr. Wyshynski, it's satisfying work.
Very much so. It's nice to have a patient come back later just beaming from ear to ear and saying, I love it.
It's been 4 weeks since the facelift surgery. Beryl's been recovering at home, and today we're going to visit her here. Hi there.
Hi.
How are you?
Good.
You look great.
Thank you. I feel good.
Come on in.
A month spent pampering herself on doctor's orders has really paid off. If you remember, just before her surgery, Beryl said she'd had no second thoughts, but she did a few days later.
I looked in the bathroom mirror and I couldn't see me at all, not even my eyes. My eyes didn't look like my eyes. And it was very, very scary. And I thought, oh no, I'm going to look like this forever. It's never going to go away.
Despite the doubts and fears, Beryl followed her routine conscientiously, getting plenty of rest and applying the compresses and creams as instructed.
For instance, he'll say to me, if you can apply the warm compresses with salt 10 times a day, do so. And I've probably done it about 40 or 50 every day. When I think back, I'd never have thought that I would look like this in just 4 weeks.
Well, you do look great.
Thank you.
You must be pleased with the results.
I am
so far.
very, very pleased.
We're going to cut 6 inches off Beryl. Oh, no.
It's 3 months later now, and like most facelift patients, Beryl books a day at the salon to spruce up her image, so the effects of the surgery blend into a whole new look. The goal is a more youthful, energized appearance, and many people opt for a new hairstyle, a change in makeup, and even wardrobe. That way, other people notice an overall transformation instead of focusing on the alterations in the face alone.
How are you? Good to see you.
Hi, Lynn. Good to see you.
Although the surgeon considers the 6-month mark the final result, Beryl is showing off her new look to rave reviews already. The facelift has been worth the time, the expense, even the pain.
And would I ever do it again? In those first few days, I definitely did say never. But now, oh, definitely I'd do it again. No problem. In 10 years, if I need it, I would definitely do it again. It's a pain that you actually forget so fast.